Usually this is managed, by the patient at home. Again, all of this is just managed by the patient at home, obviously with annual reviews, or even more reviews when it's someone who's much more severe. It doesn't need to be an annual review. It can be much more frequent in terms of trying to change and find a management plan that works well. And the most important thing really is obviously that if a management plan is working really well, stick to it. If it's working, that's fine. And remember, this is a chronic disease that just needs long-term management, really. So in terms of acute exacerbations where it's an emergency, it's done in a hospital, usually with a nebulizer, where the bronchodilators are given with oxygen, and if that is not, if it's not helping, IV methylprednisol is given as well. If that is not working, magnesium sulfate is given, and people can be hospitalized if it's someone who is not responding well in NE, or if it's someone who is known to not do very well, or if it's someone who has a comorbidity that is serious, such as kidney disease, diabetes, heart disease, or someone who cannot manage it on their own at home, or an elderly person really who is not doing well in terms of, or even if it's a younger person, in terms of the acid, the arterial blood gases, or if it's someone with an altered mental state, because obviously altered mental state again is an indication of serious hypoxemia and hypercapnia and respiratory acidosis. So now I won't do emergency now, but anyway, in here I have discussed what asthma is. Really, this is just to complement the COPD or the obstructive lung disease talks. And I've just quickly covered asthma, mainly looked at its pathogenesis and how it's diagnosed and how it's managed, and indeed how B cells are primed and how they're activated in nuclear switching by T helper 2 cells. And so I think in the next talks, because I feel like I have ticked off respiratory medicine, so in the next talk I will just continue with hematology as quickly as I possibly can. And now that I've talked about actually it will link in really well now that I've talked about the class switching in secondary lymphoid organs, that fits in really well with lymphomas, B-cell lymphomas, such as Hodgkin's, non-Hodgkin's, mantle cell. So yeah, that and Burkitt's actually. So that will fit in, and actually, the multiple myelomas, the paraprotein. So that fits in really well. So that's where we'll go next time, and I'll leave this asthma for now.